Assalamu alaikum. My name is MSR Aziz. I'm from first year MBBS, and today we are going to discuss the joints of the upper limb. Now, the upper limb has a variety of different joints. We have the sternoclavicular joint, we have the acromioclavicular joint, we have the shoulder joint, we have the elbow joint, we have the superior and inferior radioulnar joints, we have the wrist joint, we have the carpometacarpal joints, the metacarpophalangeal joints, and the interphalangeal joints. मगर आज जो joint हम discuss करेंगे, it is the shoulder joint. Now, what do we know about the shoulder joint? The shoulder joint is of a synovial type, और इसकी जो variety है, it is the ball and socket joint. And we have another name for the shoulder joint, it is the glenohumeral joint. Now, if we break these two words apart, we get gleno and humeral. Now, gleno comes from the glenoid cavity or the glenoid fossa that is on the scapula, and the humeral, of course, it comes from the humerus, the head of the humerus. Now, when the head of the humerus and the glenoid fossa, they come together, they articulate and they make the shoulder joint. Like in any other joint, ligaments have a very important stabilizing role in the shoulder joint as well. अब हमारे पास तीन मेजर टाइप ऑफ लिगामेंट्स होते हैं जो कि शोल्डर जॉइंट पर प्रेजेंट होते हैं. द फर्स्ट वन इज द ग्लेनोह्यूमेरल लिगामेंट्स जो कि खुद तीन टाइप्स के होते हैं. देयर इज द सुपीरियर, द मिडल एंड द इंफीरियर लिगामेंट. It forms a capsule and it encloses the glenoid fossa and the head of the humerus. The other ligament is the coracohumeral ligament, which spans from the coracoid process to the greater tubercle of the humerus. The third is the transverse humeral ligament, which spans between the two tubercles of the humerus. Talking about the neurovasculature, the shoulder joint is supplied by the anterior circumflex humeral artery, the posterior circumflex humeral artery, which are both the branches of the axillary artery, while it is innervated by the lateral pectoral nerve, the axillary nerve, and the suprascapular nerve. Movements are abduction, adduction, medial rotation, lateral rotation, flexion, extension. Have a look at the muscles that are responsible for these movements. I hope the joint is clear now. Thank you so much for your time. Stay safe. Take care. Allah Hafiz.